Hello, my name's Richard Burgess and I'm the Managing Consultant here at Bourne Safety. We provide a range of quality health and safety environmental services to different sectors throughout the UK and to companies of all sizes. One thing that we see a lot of is risk assessments, and all too often we come across the same issues with risk assessments, and because of that I wanted to talk about risk assessments today to try and give a better understanding on why we need to do them and how to do them and how to make sure that they impact your organisation positively. I want to try and get away from them being seen as a paperwork exercise, an administrative burden, and actually make them meaningful to organisations, and we help a lot of organisations achieve that. So, right, without further ado, how to complete risk assessments. So firstly, why do we need to carry out risk assessments? There's the moral reasons. Clearly, employers have a duty of care to their employees. Society expects them to protect their employees, or at least to take reasonable steps to make sure that people aren't hurt as a result of the undertakings that they have. And because you care, you're an employer, you don't want people to be hurt under your charge. Now, there's lots of sensible economic reasons why we should risk assess. Clearly, if we have less injuries, we have better productivity, a happier workforce, we have fewer claims, injury claims, and the benefits of that, of course, are you might have lower insurance costs, increased productivity, less staff turnover, a more productive workforce because they're happier, and so on. And then the legal reasons, the obvious one. So the Health and Safety at Work Act puts a duty on employers to protect people at work and people that might be injured out of your undertakings, and also the Management of Health and Safety at Work regulations specifically require you to do a risk assessment. And yes, there's specific regulations as well, noise at work, for example, that require you to carry out specific risk assessments as well. So we're clear on the need to do risk assessments. We know we have to do them. I'm not saying that you don't know how to do your job safely, but the law does require you to carry out a risk assessment, regardless of how competent you are or anything like that. You have to do a risk assessment. So firstly, you need to have some sort of knowledge of how to do risk assessments. Generally speaking, in low and medium risk organisations, it might be enough that you are experienced in your particular industry. If you're in more complex areas, you might need to have specific training or specialist knowledge, and risk assessments might have to be carried out by more than one person in some environments, especially more complex ones. Certainly a good idea too. And clearly any risk assessor needs to be able to communicate with people because it's going to require them to liaise and consult with employees, and also to be able to record their findings and present that in a format that is easy to read and understand. So they need proper resources, they're going to need the space to carry out the risk assessment, to write it up, and they might need things like sort of cameras, something like that perhaps, to take photographs of the areas that they're doing as well. Plus templates, forms, paper, all the things that you would need to carry out risk assessment, and of course time. So I mentioned at the beginning that the sort of issues we see with risk assessments, and one is that they're rushed. Dedicate time to risk assessments; it will be worth its weight in gold. Don't rush through it to find that it's inadequate after somebody's been injured, or at the time you're pulling it out because you need to defend a claim or a prosecution. That's not the time that you want to find out that you rushed a risk assessment. We're going to talk about risk assessments in terms of the HSC's 5 steps to risk assessment. The Health and Safety Executive produced a piece of guidance called the 5 steps to risk assessment, and they are part of HSG 65, or certainly follow the principles of HSG 65, which is plan, do, check, act, and it's all about the continual improvement. Plan what you do it, check it, and then update accordingly and repeat. So first off, we're going to identify hazards. That's anything that can cause a harm. We're going to look at who might be harmed. So it's all very well knowing what can hurt people, but we need to know who is likely to be hurt so that we know who we're protecting and how we might need to protect them. We then need to actually evaluate the risks so that we can decide on control measures. We need to record our findings so that we actually have a documented record. And then, of course, we need to review them. So this is the check part. We need to actually make sure that they stay up to date and we capture any changes to that working Excuse me. So, identify the hazards. So a hazard is something that has the potential to cause harm. So this is separate to risk. This is anything that has the potential to cause harm. Now it might be a small harm, a big harm. It doesn't really matter at this stage. We're just trying to capture anything that can cause harm. Start by actually taking a visit to the workplace and walking around. See what's there and take pictures, make notes, so that you can then carry out your risk assessment a bit later. What I normally do is I've actually produced a pro forma, a template that has lots of hazards suggested on it, so that it sort of prompts me to check to see if these common hazards that I find are present within a particular workplace or activity. And you might find it useful to do the same, or get in touch, and we can perhaps share our form with you, and just use that as a starter, but also make notes if you find anything in addition to those sort of predetermined hazards on your checklist. Check manufacturer's instructions. Nowadays you can download them online, which is very easy. You haven't actually got to hunt around in your files for books, unless you've got them of course, but you can just go on, download a PDF usually of most of the equipment that you'll have in your workplace. Accident history. Of course, if you've actually caused harm to people, have a look and see if there's anything unusual in there, anything you might not have considered. Also think about activities that wouldn't normally take place in the area that you're assessing. So, you might be there in the middle of the day, but you might not be aware that a cleaner comes in at 5 in the morning every day, all by themselves, using chemicals and things like that. Or it might be that you have a night shift that works there and you're doing the assessment during the daytime. Maintenance activities is a common one, for example. They're sort of potentially ad hoc activities that can be quite hazardous, potentially, that you need to consider. Not everything is going to be going on at the time that you visit the workplace. And think about not just hazards that are going to cause injuries, but think about the ones that are going to potentially cause long-term health risks. Is there noise, is there vibration, manual handling, asbestos, those sorts of things, because repeated exposure over a long time will cause harm, but sort of being there for one day isn't likely to do anything, perhaps. And of course, look at other sources. So I've already talked about the HSE, Health and Safety Executive. Look on their website. There's a lot of useful information there. But also check your industry bodies. They're there to help. They provide lots of information about how to control risks effectively, and also the sorts of hazards that might be present in your industry. So take photos and write lots of notes at this stage. So you know what is going to harm people, but now you need to know who is going to be harmed and how. To find this out, speak to people in your work area. You might have a good understanding of the workplace. You might have been with a company for a long time, but do engage with people. Speak to a cross-section of employees that work in the area or that location, or using that piece of equipment, for example, and get their point of view. Think about who might be harmed so that you can work out the best way to control the risk. There might be people at particular risk, for example, new or expectant mothers, perhaps, young workers who might not be quite as knowledgeable about risks in the workplace or have enough experience to be able to sort of understand risk properly. There might be people with disabilities who may be at particular risk, or temporary contract workers, for example, who aren't normally in an area, and lone workers, of course, who may be very competent, but clearly if they are injured and they're all alone, then potentially the outcome can be a lot worse and might need particular consideration. And think about those people not normally in the workplace. So I talked about, when identifying hazards, think about activities that don't normally take place, but also think about people. Talked about the cleaner at 5 in the morning, maintenance people that come in, contractors, visitors and the like, who comes into the workplace that isn't normally in the workplace. And also your neighbours. Who's next to you? Who is impacted by your undertaking? Is it members of the public that walk past? You might be producing lots of dusts, for example, and this is sort of blowing across into the school playground next door, for example, and being inhaled by lots of children. Now I know that's an extreme example, but I'm just painting the picture. You've clearly got a duty of care to try and control that risk in some way, so that you're not putting other people at risk, which could be your neighbours. And similarly, they might be producing risks that are impacting your employees, so you need to cooperate with your neighbours so that you can help control risks. So we know what the harms that could be caused are, and we know who is at risk and how. Now we actually need to evaluate the risk in some way, shape or form. The way that you might do this, and I should probably point out actually the reason why you need to evaluate the risk is so that you can decide where your priorities are. It's all very well identifying 20 risks in a workplace, but where do you start? You probably start on the ones that are going to cause the most harm, the ones that have the biggest risk associated with them. So there's a couple of ways you can do this. Well, there's lots of ways you can do this actually, but I'm going to talk about two particularly common examples, things that I see, that I use quite frequently in the workplace to assess risks, to evaluate them. So the first is just a very subjective high, medium or low. So the assessor who's actually carrying out the risk assessment will apply a subjective assessment of the risk, and they will just say, I think this is a low, medium or high risk. Clearly there's lots of pros and cons to this. Yes, it's simple, but it's also open to interpretation by being so subjective, the assessor themselves and their experience of what constitutes a high, medium or low risk. But in a low risk environment, it's perfectly adequate and an ordinary way of assessing the risk. A more commonly used method is to score it in some way and to look at both the likelihood and the severity of the hazard that you're assessing. So let's take a hazard. Let's take noise at work, for example. So if we're in a very, very noisy environment, then with no control measures whatsoever, it's probable or certain that something's going to happen. So let's give it a 4. We're going to score it a number 4 for the likelihood. And the outcome is probably going to be fairly major if left in this condition, because it's going to cause some lasting disease, potentially debilitating disease. Could be tinnitus, hearing loss, that sort of thing. So we've got, what you then do is you then multiply the two numbers that you've got together. 4 and 4 is 16, or on a table like this you can just join them up and we can see we've got a 16. So this is quite a high risk. We've got on the upper end of the medium scale on this particular table, so we're probably going to want to do something about that. However, if you're in the same environment and the noise is controlled at source and everyone's got hearing protection and this is kept up to date and you can sort of hear a pin drop because it's managed so well, then it's going to be very unlikely. So we're going to give it a 1 in this particular occasion. But the severity, if the harm was caused, is probably still going to be a 4. So if 1 times 4 is 4, but we're in the green now, we've actually lowered the risk now, so we're pretty good. But this is a method that's quite commonly used, and I should point out there are many methods that you can use. More complex organisations will do sort of more complex calculations to determine the level of risk and use sort of statistics and probability and things like that to assess the level of risk, but that's usually confined to more complex and very hazardous activities. So you've identified the level of risk for each of your hazards. We use noise as the example, but you'll have a whole range of hazards that you'll actually need to carry out your evaluation of. So now that we've done that, we need to decide how we're actually going to protect people against these risks that we've identified. And the extent legally that you have to do this is reasonably practical. So you have to do what is reasonably practical to control the risks. There's a couple of ways that this is often expressed. SFARP, so far as is reasonably practicable, and ALARP, which is as low as reasonably practicable. But basically, what it means is that you have to balance, when selecting control measures, the time, the cost, and the effort of controlling the risk versus the risk itself. So, for example, you wouldn't spend £1 million to protect against paper cuts in an office with a few employees. That would not be reasonably practicable. But if you worked in a nuclear power station, you probably would spend millions of pounds protecting employees and the local neighbourhood from the various risks of not containing radiation, for example. You also, in addition to having to do what's reasonably practicable, you have to apply the principles of prevention, they're called. And again, this is quite straightforward, but you need to consider on each hazard, can you eliminate the risk? Can you get rid of it altogether? A good example of that is working at height. If you're a window cleaner, you could eliminate the need to work at height by using a pole system to clean the windows. Therefore, you've eliminated the risk of working at height altogether. Can you reduce the risk? So you need to try and reduce the risk. So you can't eliminate it, but what can you do to reduce the risk? It could be that you substitute something dangerous for something less dangerous. A hazardous substance, for example, you might have a cleaning substance that is dangerous, but there might be a perfectly adequate, less dangerous alternative. Can you reorganise your work so that it can be carried out more safely? Does it have to be carried out in a way which exposes somebody to a particular level of risk, or can it be reorganised so that that risk is lower, for example? PPE, so we all know what PPE is, personal protective equipment. Again, you need to consider whether or not PPE can be used if you can't eliminate, reduce or reorganise. But you need to think that PPE is an individual measure, protective measure, so it only protects the person who's wearing it, and it has to rely on the fact that they're wearing it properly and that it's maintained in a good condition. It really is a last line of defence. You need to think about other ways of controlling the risk before you consider PPE. It's better to stop the item falling from height than it is just to give everybody hard hats. And then there's welfare. So you're going to put in place certain facilities to try and mitigate risks if they do happen. So if somebody is exposed to chemicals, for example, do they have the ability to wash that off effectively? Or if somebody is injured, what facilities do you have in place? First aid, for example, to make sure that any severity or outcome of that injury is reduced as much as possible. And make sure that you involve and consult with employees when you're selecting your control measures. Speak to them. They'll have some very good positive ideas on how best to control risks in the workplace. I'm going to talk about generic or model risk assessments at this stage because you may find that your industry body produces what's called a model risk assessment for your activities. And in that, they may identify all the hazards that they think are present with a particular industry, and then also provide lots of information about the sorts of approaches you might want to take to control the risks. Or it might be that in addition to that, you might have obtained a risk assessment from a company similar to yours, but just make sure that you check these over, make sure that they do apply to your organisation and that they're relevant. Don't just, write your name at the top and stick it in a drawer never to be used. Check it over, make sure it captures everything, and make sure that the control measures that it has recorded in it, that you're actually prepared to do them and that they make sense for your organisation. So we've identified the hazards, who might be harmed and how. We've evaluated the risk and we've defined some control measures that are reasonably practicable. We need to record our findings now, and legally, if you employ more than 5 people, you have to record your findings. But whilst if you have less than that, you don't need to, it's worth pointing out that you still have to carry out a risk assessment. It's just that you don't have to record it. And further still, it's always useful to record it anyway as a terms of reference, because you need to communicate that information to your employees, and that's easy to do in some situations, but if you've actually got a written risk assessment, that's much easier as a point of reference for communicating to employees, clients, or anybody else, your insurers, for example, that may ask you about how you manage risks in your company. So it also helps you monitor changes as well. You can refer back to it if something's changed, and it gives you, as I said, a good terms of reference. It's always worth recording what you're doing. And what should it look like? We get asked this a lot. Is this risk assessment template any good? Does it do the job? And you'll see all sorts of weird and wonderful ways that risk assessments are carried out. Now, there is no one size fits all. It is what works for your organisation, and you will see lots of different types. But the HSE want to see certain things. They want to see that a proper check was made in your organisation on the hazards. They want to see that you've actually asked who might be affected by those hazards. And they want to see that you've dealt with the obvious significant hazards and taken into account the number of people involved. They also want to see that the precautions that you've taken are reasonable and that they actually reduce the risk so as low as reasonably practicable. and they'll want to see that your employees have been involved in the process in some way. So what you should think about is, does your risk assessment template currently capture all of those items? If it doesn't, get in touch and we'll be happy to share with you one of our risk assessment templates. But the other thing to also consider is the output of your risk assessment. So you've identified all of these things. You may have identified that some of the risks that you've assessed aren't controlled satisfactorily at the moment, and that the control measures that would be reasonably practicable have yet to be implemented. So you'll quite often also see at the back of a risk assessment an action plan, or perhaps elsewhere an action plan that details what else needs to be done. Consider both the short and long-term controls that you need to take. So the immediate fix might be to throw PPE at a situation, but longer term you might want to control the risk at source, or look at collective measures so that the workplace is safer generally. Lastly, you need to review it, and you should do that periodically, and that's up to you to decide the frequency. And I would do that based on the sorts of risks that you're controlling. You know, how dangerous are they really? If it's a very high risk area, then you're probably going to want to review it more frequently than somewhere that's at less risk. Or if it's an area that's prone to lots of changes, then review it more frequently than areas where there aren't very many changes or it's low risk. But certain events will trigger you to review your risk assessment in any case, such as changes. So if it has changed and you haven't reviewed it, have a look, because it may no longer apply, or you might need to update it accordingly. You might have cause to. Any reason. Could be a demand by your insurer, it could be a change in legislation. Any cause that you have to need to review it, obviously review it. And also accidents. Of course, if an accident happens, do have a look at your risk assessments, because there may well be a failure of your risk assessment or something that you might have omitted to include that's led to this accident. So have a look and update it accordingly. So what should you do now? So the fact that you've got this far, well done, but review your existing risk assessments. Take the time to have a look and see, do your risk assessments cover the 5 steps, and have you recorded them properly? Are you covering everything that you do? Are you managing them? So are you keeping them up to date? And are you communicating the significant findings to your employees? Make sure that you do these things after this presentation, and we'll be happy to help you if you need it. So, sorts of things that we could do to help you. We can carry out risk assessments and provide you with advice on how to carry out risk assessments. We can review your QHSE arrangements and provide you with a gap analysis and action plan on how to sort of get perhaps back on track. We also supply QHSE management software. Specifically, we supply the Mango QHSE software, which is a nice simple piece of cloud-based software that will help you manage your QHSE systems. It's completely compliant with ISO and OSAS standards. So if you've got 9001, 14001 environmental certification, for example, you can use a system like ours, like Mango, and it will work very well and save you a lot of time and help improve your compliance. We can also carry out risk assessment training. We've got out-of-the-box packages, and we can also design bespoke risk assessment courses as per your specification if required. So if you do need help, please do get in touch. We'd love to hear from you. As always, please do give some feedback to this presentation. We'd like to hear what topics you'd like us to cover in future presentations, and just to see whether or not you found it useful. Thanks for listening, and speak to you soon.